Okay.
Okay. Good afternoon, everyone. As you know, my name is Nell Moten Capel. Tonight, I will be interviewing a colleague of mine and a past supervisor of mine who graduated from Clark Atlanta University with a Bachelor of Science degree in psychology with a postgraduate degree in public management from the University of Georgia. Ms. Grier has had a wealth of experience in working with seniors, primarily in the case management social services arena. And today I wanted to interview her regarding the Medicare Advantage programs, basically because she's had some direct experience of working in those programs. I wanted to give you a little bit of her background. I think that's quite enough. And so far, we're going to go ahead and get into our interview because I don't want to prolong the time. We only have 15 minutes. Uh, Her name is Penelope Grier, and we call her Penny. Ms. Grier, how are you today?
I'm fine, thank you. How are you, Ms. Capel?
I'm good. Thank you for asking. Today we wanted to talk about a little bit about the Medicare Advantage plans, telling us the different plans that there are out there, telling us about the plans that are in the state of Georgia, and what the Affordable Care Act impact has been on these Medicare Advantage plans. The first question I wanted to ask is to do with the different types of Medicare Advantage plans that are currently available within the United States.
Well, there are at least three that I'm aware of. It is the Medicare Advantage Plan, HMO. There is the PPO, and there is the PFFS. So you want to talk about the health maintenance plan, organization plan, which is the HMO.
Right.
And the PPO is the preferred provider organization plan. And the PFFS is the private fee for service plan. And when we talk about the HMO plan, that is, let me just start off by saying the difference.
Okay.
The difference in the Medicare Advantage plans as opposed to what we remember for so many years up until about 2003 as the traditional Medicare plan. The traditional plan is still in effect. It is a choice now that people 65 and older who are Social Security beneficiaries can choose between the traditional plan or the Advantage plan. So just wanted to make that distinction. If you use an Advantage plan, you cannot also use the traditional plan. It's either or. So with the HMO plan, that is a plan much like most HMOs that we know is within our benefits, which is a health plan that will allow you to pay a deductible, pay a premium, and have see your doctors. Now, the thing about HMOs is you have to stay within, in most cases, here in the state of Georgia, you have a network of doctors to choose from. You must marry a primary care physician who is like your coordinator, who can make referrals to specialists. But if you stay within the network of that plan, you can get those services for less cost. And I think that's probably the most popular one. And HMOs are under the Medicare HMO plan offer other things. That makes the difference between it and the traditional. The traditional is always going to pay 80% of your medical costs, regardless of where you are in the United States. But the Advantage plan is you may have other services such as care management services, drug coverage with some of them. So there's other benefits to those plans. The PPO is a little different in that it actually allows you to go to specialists or to a doctor of your choice. It may cost you a little less because it's always going to be cheaper to stay in the network, but those plans will pay a certain amount for you to go to another provider outside of the network. You don't have to have referrals for specialists to go see specialists in that plan. You can just choose your specialist. It's always less expensive to choose one within the network. And then your PFFS, which is private fee for service plan. And that plan is what they would consider a Part C plan. And it is negotiation between Medicare and the provider, the contractor. For an instance, it could be Blue Cross Blue Shield, Cigna, whoever is contracted with Medicare to provide this benefit. It is a negotiation between Medicare and this particular provider as to how much Medicare will pay them for a particular service. And you, the beneficiary, has to be ready to come out of pocket for what cost this plan does not cover, part of it that they don't cover. So it's pretty much a set plan. In other words, if Medicare say, you know, through this plan, I will pay $50 for your hearing exam. That is all they're going to pay, regardless of what the doctor charges you. With all these plans, recipients must be careful to check with their provider to assure that their provider is in a contract and is a provider, so that they can receive their reimbursement.
Very good. One other thing I wanted to ask, now if you, I think I heard you say about the HMO, that usually you have to have a primary care doctor.
Right.
Okay, and the difference in that and PPO would be that you do not.
You do not have to. The only thing is, you may end up paying more for your deductible if it's not with PPO, if it's not within that network. Right, correct.
Okay. Now, what about prescription drugs? Do these plans have that, or do you have to buy that prescription drug plan separately?
Most of them do.
Okay.
And if not, if you are working with a particular company, insurance company, or somebody that's enrolled to be a provider, they will have a Medicare Part D plan, which is a prescription drug plan that you can simultaneously sign on to.
Okay. That's good. One thing I wanted to ask you about was here in Georgia, can you kind of elaborate on your experience in working with a Medicare Advantage provider, and also the different plans that are available here in Georgia, so that we would be able to allow people to know what's available to them?
Okay, in Georgia, I believe your 3 plans are going to be the Medicare Advantage. Actually, let me go back and say there are 4. I never want to eliminate Medicare Traditional, because it depends on your situation. Medicare Traditional is still alive and kicking and could be very beneficial, specifically with people who have great retirement benefits. If you worked on a job, you paid into a retirement benefit, and now you're retired and you're still a part of that group plan, those traditional Medicare works very well for those people. The Advantage plan is a good plan. It just depends on your situation. You know, and we'll get into that, I'm sure, later when we talk about the Affordable Act. But at one point when we were looking at what you call the donut hole, and that was the situation where you had X amount of dollars to spend within a year on medication. Okay. And so once you passed that amount, you were out of pocket for $2,500. So you just have to be careful and do your homework and make sure the plan fits your particular situation.
Okay. Now, can you kind of elaborate a little bit on the, you said like a state retirement plan? The traditional Medicare works well with that. Now, say for instance, if you were in a Medicare Advantage plan and you were also receiving benefits from your retirement that had maybe a state retirement that you already had coverage with, how does that impact, if you have the coverage, how does that impact your benefits that you would get ordinarily through your Advantage plan? Would you need to purchase an Advantage plan?
No, I would not, and you do not. I would tell you I have run into some horror stories. I will give you an example. For an example, I'll remember this particular situation where this gentleman had a retirement with the railroad. And prior to the Advantage plans and Medicare Part B becoming into existence, and if you remember back during the time of Medicare Part B, that was a big push about people needing to get signed up by a certain time. And if you didn't sign up by a certain time, you would be penalized when you later needed it. Well, a lot of people didn't understand that, and they gave away their retirement benefits. They let them go and signed up with the Advantage plan. And when they did, the coverage was definitely not the same. It was far less. You know, and I actually ran this particular this particular situation that I'm referring to and recalling right now. I remember this person being afraid and signing on with Medicare Part B. And of course, once you do that, Medicare will automatically kick you out of the traditional Medicare. And now you are now owning up to the Advantage plan. Once you give up your retirement plan, there's no getting it back. So this gentleman ended up in, at that time, what it was called, but it's like meeting your limit of benefit. Ended up in the donut hole in the month of March, and we yet had to go to December. So I have not, in all the time that I work with those plans, never ran into an HMO plan, a Medicare Part B. This is my experience, my professional experience. Not saying that it's not one that does not exist, but I have talked to many many people who were advocates and creators of the bill and everything, and I've not found anybody that can say when you had a good retirement benefit plan and a traditional Medicare, there was no Advantage plan that could beat that plan, because you are still getting the only difference in what you're getting as a retiree is now Medicare becomes your primary, but your benefit, your retirement benefit covers everything that Medicare does not cover, 20%. That's not always the case with the Advantage plan.
Oh, wow. That's good to know. We're about to run out of time, so if you would kind of touch on the impact of the Affordable Care Act and Medicare Advantage plans for us, just briefly give us a little bit of a scenario on how the Medicare Advantage plans may have benefited or may have not benefited as a result of the Affordable Care Act.
Well, my understanding is that there is a great benefit with the Advantage plan under the Affordable Care Act. I understand that in 2011, the overall the medical costs were lowered, and the benefits were better under the Affordable Care Act. So, which is great to hear, because I'm going back in my mind and thinking about the great benefits that that particular situation lost, and now the benefits are better actually under that act, and the quality of care is higher. So I'm happy that this is now the case. Also, that there could have been about $150 million saved between 2010 and 2011.
Do you foresee any better benefits coming along I understand that the Affordable Care Act is phased in, do you foresee any additional benefits available that would be beneficial to a Medicare Advantage plan beneficiary?
You know, Ms. Capel, I am not versed on that yet. There's so much still going on and unsettled about this. I know that quite a few physicians have pulled out of the Medicare program as a result of this plan passing in the beginning, but that they're coming back. So that's an indication to me that obviously something good is coming out of this act for our seniors and for people who would be recipients of the advantage fund.
Well, thank you so much, Ms. Grier, for coming out and meeting and speaking to us regarding our Medicare Advantage plans and the Affordable Care Act. I'm sure there's more to come as we move forward, but this is good information to have. And I may be in touch with you again if some of my colleagues have questions regarding the Medicare Advantage plans, and maybe we can share some information with them. Thanks again.
Well, thank you for having me.
Thank you so much.
All right.